I'm Arsha Vahabzadeh, reporting from CES 2018 at the Digital Health Live studio, and I'm really excited to be joined by Dr. Diana Eitzman, who is the Director of Agile and Commercialization at 3M C3SD. Wonderful to have you here.
Thank you for having me.
Now, 3M is doing some very interesting work looking at how these wearable devices are actually attached to people, right?
Right. So a lot of times people develop a wearable device that's meant to be attached to their skin, and the detachment of the skin is a complete afterthought. So what we do is, in medical materials and technologies, part of C3SD, we have expertise in the skin adhesives. We have manufacturing under ISO 1345, and we have tested for biocompatibility. So we've done clinical trials on our whole portfolio to make sure that if you want to wear something for 3 days, you want to wear it for 7 days. We even just introduced a product you can wear for 14 days, and basically to make sure that you are picking the right adhesive so you're not going to cause a medical adhesive-related skin injury, because if it's too aggressive for what the application is, you could potentially be tearing off layers of the epidermis. And so we have information to help you pick the right one.
Now, CES is full of lots of different companies doing wearables. Do people need to pay more attention to the adhesive?
Yes, they definitely need to pay attention to the adhesive, because if sometimes I want it to stick I want it to stick really aggressively, but they only want to wear it for 2 days. Well, I have other adhesive formulas you could be using that'll be perfectly fine and stay in place for those 2 days. So, and the other thing is to make sure if you're looking at your clinical data on wearability, you're not just looking at the wear time, how long did it stay in place, but you're also looking at, did it lift? Did it damage the skin? Is it painful to remove? And so we've done a lot of that in-house. So to give you guidance, ultimately it's always the final device that is the gold standard, but at least we have data to help you pick the right adhesives to try.
So part of it is how long is that wearable going to be in place? I guess part of it is also location and the patient group that you're dealing with?
Yes, the location is important. I would say the most important thing, however, is the age of your patient. Because if it's very elderly, the epidermis has thinned, the bond between the epidermis and the dermis is much flatter, so it's easier to shear off. The other thing to keep in mind is your skin is constantly losing moisture. The top layer is about 15% moisture, deeper down you're about 70%, so you're constantly expelling that moisture. And if you're putting your occlusive wearable device on top of it, there's nowhere for that moisture to go. So you have to make sure that you're using a solution that's able to handle that moisture so you don't get macerated skin, because macerated skin, like you're sitting in a bathtub, you get that white. It's very, very easy to damage. So you got to make sure you're watching for that.
I really appreciate your thoughts on this, Dr. Eitzman. Thank you very much for your time.
Thank you.
And good luck. I'm Arsha Vahabzadeh, reporting from CES 2018 at the Digital Health Live studio, presented by United Healthcare.